Hi and welcome to a part 2 video from the CTAD clinic. My name's Dr. Mike Lloyd. So in this video we're going to be looking at the concept of sleep paralysis, i.e. the inability to move upon waking. Now this usually happens following a traumatic dream or a bad dream or a nightmare or something like that may contain memories of something that's bad has happened in the past. So to start with, when we're thinking about sleep paralysis in this form, we're thinking about it being a dissociative state. So not something of organic or medical reasons. So we always recommend that this gets looked at properly by attending a sleep clinic, through referrals, through sort of primary healthcare services. Realistically, just ruling out the possibility that there may be sort of a physical cause for this. So sleep clinics and doctors and people like that, neurologists and stuff, can have a look at this and see whether or not there may be something going on. If not, and we're looking at this person being dissociative, i.e. yourself watching this video being a dissociative person, then we think about it in those terms. And what I'm going to look at today is effectively a before and a during type phase of a treatment strategy. So there are many different things that can be done. So I'm just going to look at a couple of very basic, simple ones. So for people to consider and discuss with a therapist, as this is always recommended to be done within a therapeutic environment, to talk it through, just to make sure that it feels safe and comfortable enough to practice these kind of techniques. To begin with then, we think about the pre. So this is about before sleep. So this isn't about what's happening during sleep or the phase of paralysis. This is about before even going to bed to go to sleep. So in the evening before, it's about changing the routines, adjusting the way that you approach sleep and therefore approach what's happening in the morning. And I always think it's best to sort of almost adopt a worst case scenario. So I think it's okay to expect that there will be sleep paralysis in the morning and to be able to say internally, especially for people with OSDD or DID, where there's an internal system, where there's maybe a lot of fear and tension, certainly about going to sleep at night. And to be able to go into that internal world and say, look, the chances are in the morning, the body's going to be freaked out, scared by the dreams, whatever might happen during the night, and it's not going to move. So we're thinking of the body as being almost like a separate construct in this way. And the goal is to develop an empathic connection to the body, to say, poor thing. It's like, we have a really rough night's sleep, we have all of these awful dreams, all these memories come in, and in the morning, the body won't move. Now, what often happens is people get really angry and frustrated with the body and sort of like mentally attack it because it can't move, and that causes the distress. What we've got to kind of evaluate that to and change that around is by saying the body's simply trying to do its best to keep us safe, and it knows if it lies entirely still, chances are it's going to be as safe as possible. It's kind of hiding in plain sight by being really still. How clever is that? So before going to bed, before going to sleep, it's about saying, I kind of expect that in the morning we won't be able to move, and that's okay. So you're sort of preempting the paralysis phase and making it acceptable. Because when people start coming to us to talk about these things, the paralysis is wholly unacceptable. It's really scary, it's frightening, it causes loads of distress, as it should do. But realistically, that isn't a problem. The body's simply trying to protect against the stress that it's picked up during sleep. What we really want it to do then is to be able to just go completely calm, completely still, and just wait until it's safe to start moving, because that's all it's doing. Once that's sort of factored in, and once that's been thought about, and the sense of the body is simply trying to protect, it's not trying to do anything dangerous, and it's not actually putting the person, if you like, or the system or whatever, in any danger simply by lying still. It's the safest thing that could be done after something really scary has happened. So to get into the habit of saying before bedtime, before going to sleep at night, it's okay if you do this, talking directly to the body. It's fine. If you do this and I wake up in the morning and you're not moving, I'm going to be okay with that. I won't be scared, I won't be frightened, because I know I'm being safe and I know you're looking after me. And it might be problematic because you might need to get up and go and do things, and there might be time limits. So railing against that, being angry, being stressed and frightened doesn't encourage the body to move any faster. Quite the opposite. All that negative emotions related to not being able to move is more likely to keep the body feeling that something bad is going on, and it's going to stay still for longer. So we work on the basis that the faster that you can be calm, the faster the body will calm, the faster the body will start being able to let you move. So preempting that at night, saying, I think this is what's going to happen and I'm okay with that, absolutely the thing to do. Now, another trick, if we want to add one in, is that if you really do need to get going in the morning, let's say you've got to be up and out at 8 a.m, set an alarm for 6:30, so that if you wake up and you've got paralysis, you've at least got time to try to bring yourself back before you need to get up, so you're less stressed about these kind of things. And if you position the clock in a place where you can see it from the lying down position, and you know what time it is, you think, I've got loads of time to calm, everything's going to be okay, I can get on with it. So the part 2 of this part 2 video, if you like, is what to happen when you actually wake into the body and the body won't move. And I think you can probably guess from what we've said already is the goal here is to be calm. So if you've done the work on the night before and you wake and the body can't move, it's much better to then be able to say, I knew this was going to happen. Hey body, I know you're just trying to protect me, but let's look around the room. So use your eyes and you can see how still everything is. Nothing's going on. You can listen, you can hear, nothing is going on. As long as everything is still and nothing is happening, you'll be able to say internally within the body, we are okay. Everything is all right. Thanks for helping. Now I need to get moving, but on your time, right? You need to know when it's ready to move. You need to know when it's safe. You let me know that by letting me move. And there's a few things that you can do in the meantime. You can, let's say, hum a tune that you like. If you want to really be careful about this sort of stuff, you can, let's say, place stars, those kind of little things, or little pictures or little stickers or something on the ceiling. So as you're lying in bed, you can look up at the ceiling and you can see the things and you can start counting things and you can do sort of mental gymnastics of the stuff that you've placed around, stuff around the room, anything that you can see that you can start grounding yourself with in order to just say to the body, look, I'm so calm, I'm counting how many books I can see on my bookshelf. I'm counting how many stars I can see on the ceiling. I'm humming one of my favorite tunes. I'm simply lying here with you, waiting for you to let me be able to move. And if you start getting small movements in your fingers, in your toes, let's say, then you can thank the body and say, you're starting to give me things back. Let's just test and see if I can wiggle my toes. Let's test and see if I can wiggle my fingers. Let's test and see if I can screw my nose up a little bit. So you do all these tactics in order to say to the body, hey, you're starting to give me some connection back. You're starting to give me control back. Absolutely fine. I'm still patient, I'm calm, and I'm waiting it out. The main thing is to try as best as possible and keep a very, very healthy, calm set of breathing motions. So if there's waking and there's panic and there's distress, the body is simply being told physiologically something bad is happening, best not move. So if the breathing is calm, if you wake into that state and you're not frightened because you preempted it the night before, and you breathe calmly and you're just listening inside, saying to the body, we're good, we're fine, we can get moving, everything's going to be okay. Then the body will listen and gradually it'll start giving movement back. And the goal is to get the movement back as soon as possible. And when movement starts coming back, to say to the body, thank you. So instead of being angry at the body for creating the paralysis, it's to thank it for creating the paralysis because it was only trying to help. It didn't need to help. And this is where the body gets tricked by the trauma dreams or the memories, because there is no danger. These are simply dreams and memories. Bad though they may be, they're not actually dangerous. The body's being tricked. So we should be kind towards it. We should reassure it that all is fine, all is okay. And when movement comes back, it's not to then start rushing around and dashing about. It's to take a bit of time to say to the body, thank you ever so much for giving me my movement back, but you can see that I was in no threat, I was in no danger. You didn't need to do that, but I appreciate you trying. And then that evening, again before sleep, you say, maybe it'll happen again, maybe it won't. If it does, we'll be okay. And it becomes a pattern of communication between the mind, the self, and the body, ultimately to a goal where there's no more sleep paralysis, or the body checks in and almost to say, do you need me to keep you still? No, brilliant, move, up and out, start your day. So those are the two strategies. So one's a before and one is a during. There are some after things that can be done just in terms of that appreciation thing as a little add-on. Again, making sure that there's no actual medical cause for this stuff, making sure that you have a good communication within the system, and ideally to be able to talk this through with your therapist to start working out the script for how you can communicate and who listens and who may be in charge and what kind of things can be done depending on the nature of the system. Really, really key therapeutic processes. So I hope this has been helpful as a little bit of a self-help guide. Please do leave comments as always, and we sort of like reading those and just sort of seeing what people think about the videos. Do all the likes, subscribing, all of that kind of stuff. And in between now and the next video, as always, please do take great care.